Some time with my friend Frank Granett. He is up there in Michigan, and he and I are working together. We have an ongoing project that we call the Price of ADHD Business. It's a great series. It talks about the business implications of ADHD, the over-medication of our young people, and talking about really raising the quality of the debate on this subject. And you'll find a huge number of articles and audios over at both usdailyreview.com and priceofbusiness.com on this topic. And it's been too long, but my understanding, Frank, is you've got a lot of interviews coming up in the pipeline now.
Oh, yeah, Kevin. We got a great program lineup. And to give our listeners an update, CAOOY.org, that's Coalition Against Over-medicating Our Youth. We are now officially a 501c3 nonprofit educational public charity, and what we do is help parents help their children determine the cause of those underlying neurobehavioral symptoms before they go to the drug therapy. And today, Kevin, we are privileged to have a great guest with us. He is Dr. Charles Shubin. He's professor of pediatrics at University of Johns Hopkins, one of the most prestigious medical schools in the country. He's director of pediatrics at Mercy Family Care in Baltimore, Maryland. And Dr. Shubin, great to have you on our program today.
Happy to be here.
Tell us a little bit about your practice and the work you do.
Well, I'm a general pediatrician, although I also have activity involved with a top high school here in Baltimore, the Baltimore Polytechnic Institute. And basically, we see pretty much the whole gamut of problems that kids can have. We get a lot of referrals from mostly schools. Essentially, I would be nice and call it requesting, but in reality demanding that we make a kid sit still. And by that, they mean give the kid medication. And there are kids who need that. We know that. But the reality is the vast majority of kids, the not sitting still is a symptom. And you need to go, as Frank just outlined, to the cause. Where does this come from? ADHD, one could argue, despite having a definition as a disease, is really a symptom complex. It presents as a combination of inattentiveness and restlessness. The kids can't sit still and they can't pay attention. It's interesting that the American Academy of Pediatrics, in its revision of its guidelines in 2011, came out with a very strong statement that before considering treatment, one should, quote, rule out all other causes. Clinical evaluations should include assessment of conditions that might coexist with ADHD, end quote. That's been my philosophical approach. I don't want a kid to be considered, being as I have to do the prescribing, for a controlled dangerous substance. Don't lose sight of that. Almost all of the medicines are. Without a complete evaluation. Now, that means psychological, educational, mental health, and medical. Yeah, I'll do my part, absolutely. But under the circumstances, most of it is going to have to be done by our colleagues in education and mental health fields. Trouble is that usually falls on school systems that aren't exactly rolling in money, and so they balk. It's much simpler to them to drug the kid and make them sit still. Whether that's the correct thing for the kid or not really their issue. So I'm not in good standing with many of the schools around me because they don't like the idea that I won't just prescribe the medicine, as unfortunately some doctors will.
Yeah, your question there, Frank.
You know, Dr. Shubin, we talked earlier, and as far as, do you see a trend now, like in our medical schools across the country? And I know at Johns Hopkins, they were voted number one in behavioral health sciences at the medical school in 2011. Do you feel overall across the board the medical schools are gearing their new physicians under study to recognize, let's go after a more thorough, comprehensive assessment before we go to drugs? Do you feel that's being taught yet, or is that something that's still kind of an evolution right now?
No, I think we're seeing that. I think we're seeing that being taught. The problem isn't what we can teach in the medical schools, which is a little bit more theory than practice, but what in the reality of the real world you're stuck with a demanding school who says we're not going to let the kid come back until he's controlled. Parents who are at wit's end because they have a child who needs to go to school, and they need the kid to go to school, and may indeed also be a problem at home. And so we have pressures that come to bear on the practicing prescriber that can sometimes be overwhelming.
You know, you said something that was really very profound and yet incredibly simple a couple answers ago, and you said that the reality is the behavior is a symptom of something, and it's just kind of a knee-jerkly, almost a societal thing, and it's being done to accommodate society, not to meet the need of the patient, to simply call it ADHD. Isn't that really what you essentially said?
It really is. I think we are a symptom-treating society in the sense that we want relief. We want our problems to go away. We don't necessarily want the causes to be dealt with. So when it comes to other kinds of symptoms unrelated to this issue, but simple stuff like cold symptoms, an upper respiratory infection, we want relief. The reality is there really isn't anything that will treat, and certainly nothing that will cure, colds at this point. But we want relief, and so we have a huge market, billions and billions of dollars of medications that the FDA will point out have never been shown to work, and yet people are buying them left and right. Well, this is the same approach. The approach is we have a symptom we don't like. The kid won't sit still. Let's get him to sit still, and everybody will be happy. When you've got a class of 30-plus kids, and one teacher, maybe with an aide, maybe not, in fairness, a kid not sitting still is a big problem for them, and that's going to take away from all the other kids. So there are issues here that have to be dealt with, but medication is probably not the first step in doing that.
When we look at overall, when we look at overprescribing, which is essentially one of the parameters of overprescribing is simply putting a young child on a psychoactive medication without going after these assessments that we talk about in the book, The American Epidemic. We talk about it in our educational DVD, and Dr. Shubin has a wealth of articles that he's written in the past. So there's a direct correlation between this overprescribing and abuse, and that's what we're seeing in our young adult population now across the country. Now we have the epidemic of academic doping with Adderall on college campuses, and never before in the history of the United States have we had suicide as the number 2 cause of death in our college student population. So I commend Dr. Shubin on what he's doing in Baltimore, Maryland, and as far as all the other physicians out there that can recognize the trend is to go after more comprehensive assessments before we go to that premature drug use.
I got to wrap it up. This interview is going to show up, I'm sure, with a short article by Frank. He usually does that over at usdailyreview.com. And great interview. Dr. Shubin, thanks for your time. I appreciate it.
I'm just happy to offer a point of view from, as we call it, the trenches.
There you go. Well, you did a great job, Dr. Shubin.
Well,
glad to have you on. And, of course, Frank, he's a regular here on the Price of Business. You can learn more about him at CAOOY.org. And, of course, I suggest you look at Frank Granett at usdailyreview.com. You'll be impressed by the many articles that we have there. Thanks, Frank.
Thank
you,
Bye-bye.
Kevin.
All right. When we come back, much more for you right here on The Price of Business.